Hi there. Did you know that depression can increase the risk for dementia as we get older? Today, we will be discussing what depression is and what you can do about it. This video is part of a series on how to identify and reduce risk factors for dementia. Dementia is a general term for loss of memory, language, problem-solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease and vascular dementia are two of the most common types of dementia. In this video, we will be discussing some sensitive topics such as suicide. Depression is a serious concern that is treatable. Stay tuned until the end of this video for resources if you need help. You may be wondering, what exactly is depression? Depression is more than just feeling down every now and then. Doctors refer to serious depression as a major depressive disorder, which is a mental health problem that is diagnosed by a professional, such as a family doctor, psychologist, or psychiatrist. People diagnosed with major depressive disorder may experience many symptoms that affect their ability to carry out their day-to-day activities. To be diagnosed with depression, symptoms need to last at least 2 weeks, but could often last much longer. Here are some of the symptoms to look for if you think that you or someone you know might have depression. Experiencing long periods of sadness or feeling low. The inability to enjoy life. Changes in sleeping patterns, such as needing to sleep more or having trouble falling asleep or staying asleep. Often feeling fatigued. Unintentional weight loss or gain. Difficulty concentrating or making decisions. Feelings of guilt, worthlessness, or agitation. Lastly, having suicidal thoughts or planning or attempting suicide. People with depression can have different combinations of these symptoms without experiencing all of them. Everyone can experience occasional changes in their mood. However, depression is more than just a few days of sadness. If you find that your mood has been interfering with your day-to-day life, reach out to your caregiver, loved ones, and a professional for support. Depression is not a normal part of aging, and it can be effectively treated. Anyone can have depression, and it is quite common in older adults. Prior to the pandemic, approximately 1 in every 20 older adults had depression. And those rates tend to be even higher in older adults who require care from others, whether at home or in a long-term care home. The number of people, including older adults, living with depression increased substantially during the COVID-19 pandemic. Signs of depression can vary between people, and symptoms may differ from an elderly person compared to a younger person. Older adults will tend to have more of the following symptoms: problems with memory, avoiding social interaction, difficulty with performing everyday activities, such as taking medication, eating, dressing, and bathing. Additionally, depressive symptoms in older people tend to be more severe and long-lasting. It is especially dangerous in older adults when there is a risk of suicide. Individuals who have been recently diagnosed with dementia have a higher risk of suicidal thoughts and attempts, so it is especially important to look for warning signs of suicide. Any depressed person might be thinking of suicide if they talk about wanting to die, feeling shame or extreme guilt, being a burden to others, and/or if they withdraw from friends and/or say goodbye, give away items that are important to them, make a will, investigate ways to die, or have plans to kill themselves. If you notice any of these warning signs of suicide in yourself or a loved one, it is important to get help as soon as possible. Generally, men have a greater risk of suicide than women, especially as they get older. Among men, the highest risk of dying by suicide are for those aged 75 and older. Among women, those aged 45 and 64 are at higher risk of dying by suicide than women of other ages. You might be wondering, is there a relationship between depression and dementia in older people? The answer is yes. In fact, those over the age of 65 who have depression are at twice the risk of developing dementia compared to people over the age of 65 without depression. The symptoms for both depression and dementia may overlap due to their close relationship. Overlapping symptoms in both depression and dementia include lack of interest in activities and social interactions, difficulty with concentration and remembering, changes in sleep patterns and in the amount and quality of sleep. It is also difficult to diagnose depression in older people with cognitive decline, as these individuals may not be able to communicate their symptoms or describe how they're feeling. If you're a caregiver for someone with dementia who is showing signs of depression, there are a number of ways to assist them. For example, you can talk to their doctor or healthcare team about the depression symptoms you have noticed. If your loved one is found to have depression, you can work with their doctor to figure out the best way to help. It can be either getting a prescription or being referred to a mental health professional who specializes in working with people who have cognitive decline. How common is depression in people experiencing cognitive decline? Researchers have found that up to 40% of those with Alzheimer's disease have depression. If you are noticing the symptoms mentioned earlier in your loved one, there could be a possibility that they might be experiencing depression. Don't hesitate to connect with a healthcare professional about your concerns. Have you ever wondered, is there anything I can do in addition to seeking medical help for my depressed loved one? The answer is yes. Reach out to them, express your concerns, and show that you care and appreciate them. Be available for them if they want to talk about their feelings. If you see that they're struggling to perform routine life activities, you can help by offering assistance with cooking, shopping, and housework. Your loved one will appreciate your kindness and acts of service. Even the smallest efforts can go a long way with supporting their mental health journey. No one chooses to have depression, and it's not anyone's fault. In fact, anyone can experience depression, so it's important to speak to people with kindness and avoid giving unhelpful advice. Saying things such as, "Don't worry, just be happy," or "snap out of it," are examples of things that can negatively affect those living with depression. Instead, be empathetic by listening to them so that you can better understand where they are coming from. These actions can make a big difference in having your loved one feeling supported and cared for. Now you might be wondering, can depression be treated? The answer is yes. The main strategies for treating depression include medication in the form of antidepressant drugs and various talk therapies. Antidepressants work by addressing the brain chemistry that contributes to depression. However, the most effective approach is combining antidepressants with talk therapy. This combination can help to address the repetitive, sad, and self-defeating thoughts that tend to be associated with depression. You can talk to your doctor about getting the treatments just mentioned if you feel as though you might be experiencing depression. One particularly effective form of talk therapy is cognitive behavioral therapy, or CBT. It is helpful for people with depression at any age. However, CBT might be difficult for those with dementia, as it involves doing homework to practice the learned skills. We know that memory can be difficult for those with dementia. However, if your loved one is someone who is in the early stages of cognitive decline, they might be able to benefit from CBT. Luckily, people who have dementia and depression can still participate in therapy. One study found that a group mindfulness-based therapy program helped those living with dementia to feel less alone and improved their mood and concentration. You can ask your doctor if there are any mindfulness programs for depression in your area. Participating in social activities and getting more physical exercise also helps with depressive symptoms. Other approaches that might be helpful include creating a daily routine and scheduling enjoyable activities that can improve your mood. These lifestyle changes and physical exercise can help to alleviate depressive symptoms by improving well-being. Now that we have learned about depression, who is at risk for depression? Anyone can have depression, but the risk tends to be greater among women and those who are not married. Health concerns such as pain, hearing loss, and vision problems can also increase the risk of depression. In addition, those who are socially isolated or feel lonely have a higher risk of depression. Even if you are at risk of depression, there are some steps you can take to reduce those risks and improve your mental health as a whole. One of the best ways to do this is to improve your social network through joining a social group, library program, or your local community center. Having people in your social network on whom you can rely can help you overcome obstacles in life. Participating in regular physical activity can also protect against the development of depression. Social interaction and physical activity are important for preventing depression. You can refer to our videos on social isolation and active living for ideas on how to get started, as we explored the different ways to improve your social connections and level of physical activity. Depression shouldn't be something you suffer from, as it can be treated. It is never too late to seek support, as there are many people, including professionals and loved ones, who are here to support you. It is never too late to seek support for depression. If you are experiencing a crisis and need to talk to someone right away, the Canadian Suicide Prevention Service is available 24/7. Contact them at 1-833-456-4566 or 1-866-277-3553 if you're a resident living in Quebec. Together, we can all work together to tackle depression one person at a time.